It is no secret that hiking the Appalachian Trail is hard. The path brings on a number of physical and mental challenges. And after seeing some stories about other people, Tom Gorman and his wife Betsy decided to put themselves to the test.
If they could do it, we ought to be able to do it.
The rough terrain, steep climbs, and slippery hills couldn't have prepared Tom for an even greater challenge ahead. Around the time his hiking journey began, Tom had an unusual reaction to a vaccine, losing almost all ability to move.
Well, I'd like to walk again. I'd like to be able to use my hands again. I just want to be able to live a normal life.
Determined to get back on the nearly 2,200-mile-long footpath, he turned to physical therapy for help. But his therapists were skeptical at best about his recovery.
Honestly, it was bleak.
In 2021, Tom was diagnosed with Guillain-Barré syndrome, a condition where the immune system attacks the nerves, sometimes leading to paralysis. According to Arnot Health's infectious disease specialist, Dr. Justin Nistico,
there have been people who have recovered, and it's just important to know that there is large variation in between individuals who get this condition.
And in the beginning,
He was max assist times 2, meaning he could not stand independently without 2 other human beings helping him.
After a while, things seemed to look up.
Finally started to make some progress, and we're finally starting to get some feedback. He's moving his feet independently. He's able to move his lower half, and so we're starting to weight bear. We're starting to do sit to stands. I can remember we had him on a mat table, and then one day he came in, he couldn't do half of what he was doing the day before.
Tom's providers felt they only had one option.
I had to go back to the hospital.
According to Devin, there are times where patients can seemingly decline overnight, and it's often temporary. In Tom's case,
It wasn't one that had kind of went away within the course of a few days. We were sure of it. We had sent him to Syracuse, and we had some further testing done with some specialists out there. But yeah, we were very scared.
the diagnosis from the doctors in Syracuse was grim.
My neurologist came in and said, you'll probably never walk again. So we're not going to focus on rehabilitation. We're going to focus on adaptation. And my heart just sunk.
But Tom wasn't ready to remap his path.
That's when I said to myself, this is not my lot in life.
When he saw his doctor again,
Told the neurologist that tomorrow I would like to try and stand and walk. And tomorrow came, and I was able to.
eventually, he was cleared to return to physical therapy, having to start from the beginning all over again.
In terms of just, making him feel that his goals were the priority that we had, right? He's a hiker through and through. We're gonna get you hiking again, man. So we're not gonna do, the boring 3 sets of 10 where you're sitting. No, man, we want you on an obstacle course, man. We wanna get you, we wanna challenge that balance. We want it to be fun, but we want it to be functional.
According to Devin, Tom really didn't need much to keep his drive to recover going.
Tom Gorman is about as motivated as they come. I mean, he is 1 in a million.
With careful, intensive care and a successful treatment plan, Tom is walking, using his hands, and working his way back to what he wanted from the beginning, a normal life.
It's like I've been given a second chance.
Whether he starts the day out on the right foot or the left,
I can walk. I got to get out, and I have to walk. I have to hike just because I can.
for Tom, it's all about how important that first step really is. Reporting for Arnot Health, I'm Lexi Cutmore.